Hi, my name is Thomas Chang. I'm in the bioengineering department and I will be presenting on the quantitative analysis on superior oblique palsy surgical outcomes using Hess screening tests. My mentor for this project is Dr. Wei. Some background on the issue: strabismus, also known as crossed eyes, is misalignment of the eyes due to defects in neural control or extraocular muscle imbalances. On the right is an image of the 6 extraocular muscles. Superior oblique palsy, or trochlear nerve palsy, is when the superior oblique muscle atrophies. This hinders the eye's ability to move in certain ways, causing strabismus. The goal for this project is to quantify some commonly used surgical interventions to better understand how changing the eye will impact its movement and hopefully advise future surgeries. To do this, we use Hess screening test results. Here are 2 examples of Hess tests where 21 different gaze positions were plotted on a grid where each box represents 5 degrees and the center of the box is the primary gaze. The top image is of a pre-surgery test, and as you can see, a lot of the gaze positions are further from the ideal positions marked by the orange dots as compared to the bottom image, which is of a post-surgery test. We automatically translated these graphs and subtracted them to find vector fields characteristic of each surgery. Here are the group and results mentioned. The first group is of patients who underwent recession of the antagonist muscle, the inferior oblique. The second group is of patients who underwent surgery on their unaffected eye's inferior rectus, which controls downward movement. And the third group is of patients who underwent both of the previous surgeries. 2 main things to note are the incrementant correction, which is saying that each gaze position changes a different amount, and the general trend towards the ideal gaze positions marked by blue dots. Here's the same data but focusing on the vertical displacements scaled onto a heat map. These show a much clearer correlation between each surgery and the field of action of the inferior oblique groups. Finally, we looked at post-surgery results for patients who came back 3 to 7 months from the date of their surgery. These all were scaled up by 3 times, so progression, especially on the IO and IR group, are a little misleading, but the main thing observed was the tendency for IO recession patients to see further correction towards the ideal position. Some acknowledgements for this project include Dr. Lee from the Oscar office, Dr. Demmer and Dr. Lai from the Jules Stein Eye Institute in UCLA, Andrew Ryan, who made the program to translate the charts, and Dr. Wei for helping with ideas, figures, code, and being a great mentor. Thank you.